And now our next conversation is going to be focusing on this question that is central to the future of healthcare everywhere. How do we innovate without compromising our environment? To tackle this question and more, we're delighted to have Leya Damani, Chief Sustainability Officer at PureHealth, Dr. Joanne Sadier, Senior Consultant at Dubai Health Authority, and your moderator, Layan, Shkier, Editor and Researcher at Forbes Middle East. Welcome.
Hello everyone, hope you've been enjoying the event so far. Unfortunately, we're almost at the end of the event, but I promise you this is going to be a very interesting panel. So in this panel, we will be answering a very critical question, which is, as the healthcare innovation evolves, how can we make sure that we're not harming the environment? And to help me actually answer this question, I'm joined by Leya from PureHealth and Dr. Joanne from the Dubai Health Authority.
Thank you.
Leya, let me start with you.
Sure.
So as you work with PureHealth, can you tell us how is PureHealth designing healthcare delivery to not only be personalized and efficient, but also environmentally sustainable?
Absolutely, and thank you very much for having me here today. So in 2024, PureHealth, we had our 2040 target actually validated by the SBTi, and we were actually the first company in the MENA region to have that done. So that's how we started off quite strong in 2024. For us, sustainability means resilience. It's about efficiencies. If we do things better, it's better for the environment and it's better for the people that we serve as well. So longevity of the planet is our framework. That's the thing that shows us exactly where we're going, our North Star. We're designing operations that last. In order for it to last, it means that we have to include things like artificial intelligence, we have to include IoTs, etc., within our operations. One of the most important things is sustainable care. Sustainable care means having people live healthier for longer. It means having our facilities also be stronger and more efficient. And that's what we're doing here at PureHealth.
That's absolutely great. And I actually want to focus on the practical solutions on ground. So can you tell us, so if you, for example, the remote and home-based monitoring can reduce hospitals' admissions. So can you tell us how do these innovations improve patient care and lower the sector's carbon footprint at the same time?
Absolutely. So prevention, as you've heard throughout the entire couple of days here, is what matters. It protects the people and it also protects the planet. It's the most efficient sustainability strategy that we have here at PureHealth. So we do this through 4 elements. We have our PureNet platform. That connects every part of care. That means our hospitals, it gives us the diagnostics, the insurance, everything that a patient would need access to. We have it all on one platform. It's delivering innovation efficiently. The second part is the Pure Labs. So that's our center of excellence for genomics. We use artificial intelligence and molecular testing in order for us to predict diseases. So diseases such as heart conditions and cancers, etc., diabetes. The third point is our Pure Longevity Clinic. So it takes all those insights and it gives it back to the patient to show them how they can live better with all the information. As Shkier said on the very first day, we're democratizing healthcare. We're giving the power back to the patient, to the people. The last thing and the fourth thing that we have is the Pura app. So what the Pura app actually does is give you all the information you could possibly need to be more healthier for longer. So for us, if you're living longer, that's good for us. Contrary to the belief that sick people bring in more money, that is not the case for us. We believe living longer means we have patients for longer, and if we are efficient in our operations, it means our facilities will last longer as well.
Leya, you mentioned something really nice, which is we are trying to democratize the healthcare industry. And actually, I want to see that from the perspective of the public health. So I'll ask you, Dr. Joanne, now, can you tell us how can digital public health intelligence, including AI dashboards and real-time analytics, be used to make informed decisions that benefit both the patient and the environment?
Absolutely. Thank you so much for having me here. Hello, everyone. Digital health intelligence in public health particularly will be sooner or later considered as the nervous system of any healthcare ecosystem, future modern healthcare ecosystem. There are tremendous things and implementation that could be done just by gathering the raw data that we currently have, and using the right tools, whether we get it from clinics, from hospitals, from communities, from schools. There are so many things that we can do. And to give you a brief example, at a patient level, I think the best model to explain here is detecting early signs of sepsis. From a patient perspective, by using these machine learning, they could detect early signs of sepsis before it's happening. And just this tool has actually decreased mortality by 40%, decreased the stay of the patient by 1/3, decreased the readmission by 20%. And this practice has saved the US $1.5 billion, just the US, annually. So this is a better patient outcome, but also it is sustainability in practice. Why? Because less complication, less pressure on the workforce, less expenditure. And also we can give many examples, such as all the digital tools that are taken to monitor patients at their homes, right? And these tools are feeding data to the healthcare management, and this by itself means also freeing beds and having more beds available for people who need it, right? And less commuting as well, and less pressure on the healthcare professional. I know that most of them have burnout.
Thank you, Dr. Joanne. And you usually highlight the concept of belonging as a medicine. So can you explain that concept to us and tell us also how does fostering community and mental health resilience contribute to a sustainable and holistic healthcare system?
Absolutely. When I say belonging is a medicine, I'm not joking here. It's not a metaphor, actually. It is one of the most evidence-based determinant of human well-being, and I believe that it is one of the most overlooked. And I'm certain that this is why His Highness Sheikh Mohammed bin Zayed, Hafidahullah, has declared 2025 as the year of the community. Right? And this is why this summit, Forbes Middle East, has decided to make community as the heart of healthcare innovation. Why? Because finally the world start to understand a truth that public health knows for decades, that healing doesn't happen in isolation. It happens in connections. And when a person feels that he's surrounded and supported, and he belongs to a workplace, to a school, to a community, the whole biology of this person will change, right? The stress goes down, and we shift the care from the hospital to the community, and we shift from a model of crisis management to a model of prevention and early sign intervention. Yes, I'm saying belonging is at the foundation and the core of every sustainable healthcare system.
Absolutely. And my final question is actually to both of my panelists to just tie up what we have been talking about. So can you tell us what strategies or best practices can be applied across the healthcare organizations to integrate patient care with measurable environmental impact reductions?
Sure. One of the things that we can do is implement artificial intelligence triage. It's so important. Remote monitoring and IoT tools will help us be more efficient. We can intervene early if these are implemented, and we can reduce the hospital visits, which means lower emissions. I mean, they go hand in hand. And we can advance health equity, bringing specialist care to patients wherever they are is one of the true aspects of healthcare. It's not about just coming in to visit a hospital. It's about having access to that specialist care, to those doctors, to exactly as you said, is building a community outside the hospitals. The third and final thing I would suggest is sustainability and longevity. It goes hand in hand. Like you can't have one without the other. It's about building a healthcare system that lasts for the people, for the planet, for generations to come. They're not two separate things. They are one of the same.
Absolutely. And Dr. Joanne, what do you think about that?
Again, I would say shifting the care to where the people are, more into the community, and also enhancing the patient capability of self-management as well. Because the patient is not only a passive human being just receiving the care. You are an active player and you need to take charge of your health, right? How do we do that? There's tons of ideas of awareness, program, training, facilitators, social workers, so many things. Also, I want to leverage the community partnership with a very clear framework of who acts when and why. So rather than waiting when we become at a breakup point, we can just detect if people are trained and aware, and we break the stigma so we can detect the early sign and support this person. So it would be a social responsibility rather than a human struggle in silence, right? And I've heard a lot of AI and tools. I think the most important thing is before building this, having a very solid design with a very solid governance model with highest ethical use and standard, continuous evaluation, patient safety, data quality and cleansing, rigorous evaluation, and keeping, of course, the data, the patient's confidentiality. All those goes hand in hand with the right tools in order to make it sustainable, effective, and human.
And I think that ties us back, to the idea that you mentioned that healing does not happen in isolation. Thank you so much for sharing your insights with us, and thank you so much for the audience for listening. Thank you.
Thank you.